Good evening. Welcome to the Love Your Liver Black History Month community event. This event is hosted by Blue Fairy, the Adrian Wilson Liver Cancer Association. Blue Fairy's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, through research, education, and advocacy. Blue Fairy's Love Your Liver program spreads awareness and educates high-risk, underserved populations to increase the prevention and early detection of liver disease and cancer. Thank you so much for attending today to learn about how liver cancer affects the African American community. Today, we have an expert gastroenterologist and transplant hepatologist, Dr. Cristal Brown. Dr. Brown will discuss liver cancer risk factors and how to care for your liver. At the end of this presentation, we will have a Q&A session with Dr. Brown. To submit a question, click on the Q&A icon at the bottom of your screen, type your question, and click send. Feel free to submit questions anytime during the presentation, but we will not answer questions until the Q&A session. We apologize in advance because we may not be able to answer all questions. However, throughout the presentation, we encourage you to use your react button. If you like what Dr. Brown is saying or are getting a lot out of it, feel free to give her a thumbs up, a heart, a exploding celebration, whatever you're feeling while you're getting that information, feel free to respond. Also, please note, this is an educational presentation, so please ask general questions and do not share your personal health information. Dr. Brown is not your personal doctor and cannot provide a personal medical consultation during this event. There will be poll questions throughout this presentation, and we encourage everyone to participate. Please join us when the pop-up questions come on your screen, and we thank you in advance for your participation and cooperation. If you experience any technical difficulties throughout the event, contact our program manager, Allison, in the chat section. Dr. Brown is an assistant professor in the Department of Internal Medicine at Dell Medical School in Austin, Texas. She is a board-certified gastroenterologist and transplant hepatologist practicing at Digestive Health, a clinical partnership between Dell Med and Ascension Seton. She specializes in providing care for patients with chronic liver diseases. Let's start with our poll question number 1. It's about liver cancer's effect on the Black community. Black Americans are more likely than the general population to get liver cancer. How much more? 50%, 75%, 100%, 150. One more second and we'll take in a few more responses. All right, Dr. Brown, good to see you. Could you please let us know what the correct answer is and why?
Good afternoon. Unfortunately, the correct answer here is 150%. So Black Americans are 1.5 times more likely to get liver cancer than the general population. So that's the reason that this is a really important webinar, and I really appreciate the opportunity to speak today. So we'll start by just going through the agenda for today. So we're going to talk about what is the liver and how it works. We are going to talk about what is common, how common liver cancer is, and knowing what are the risk factors for liver cancer. We'll talk about the methods that are used for screening, the available treatments, and then what are the steps that you can take in knowing your risk factors and making sure you get appropriate care. So the liver does a lot of things in the body. The liver is located at the top right part of your belly, and it is the largest organ inside of the body. It has over 500 jobs, so your liver does quite a few things within the body. And one of the things that is really interesting is that it is the only organ inside the body that can regrow itself. So of these 500 jobs, probably one of the more important things that the liver does is the liver is the body's filter. And what that means is that when different things come into the body, the liver helps to remove and filter that. And so that includes things like toxins. So when we say toxins, these can be the things that we eat and drink. So food, alcohol, herbal supplements, medications, all of that is filtered through the liver. And that means that it helps break down those toxins and remove it from the body. It also breaks down fats and cholesterol. So the liver creates a substance known as bile, and the bile will go to the small intestine. And when we eat, it breaks down the fat and cholesterol so that the body can use them. It also breaks down carbohydrates and proteins. So when we eat, it breaks those down for energy that can be maintained for our muscles and our bones. So there are a lot of very important jobs for the liver. But unfortunately, one of the things that we see is that liver cancer is becoming more common in the United States. So when we look at data from the year 2000 to 2019, we see that there is an increase of 34% in people being diagnosed with liver cancer. And what is estimated is in 2025 that approximately 41,630 people will be diagnosed with liver cancer. And of these 41,000 people, almost 30,000 of them will die from liver cancer this year, which tells us that liver cancer can be very deadly. And it's really important to understand your risk factors and to be screened so that we can try to improve these rates. So I just want to take a little bit of time. When we say liver cancer, there's more than one type of liver cancer. And today we're going to focus on hepatocellular carcinoma. And the reason for that is because that's the most common type of liver cancer. So when we say liver cancer, we're not talking about cancers that started in other parts of the body. So if someone got diagnosed with breast cancer or prostate cancer and then it moves to the liver, that's a little bit different. We're talking about cancers that start within the liver. And so that is hepatocellular carcinoma, and that is about 80% of the liver cancers that we see. Most of the time, patients will have underlying liver disease or cirrhosis of the liver, where the healthy cells become scarred due to some type of cause, and we'll talk about some of the more common causes. Other types of cancers include bile duct cancers or cholangiocarcinoma, and that's about 10 to 20% of primary liver cancers. And we won't be focusing on those today because they're a little bit different than what we see with hepatocellular carcinoma. So hepatocellular carcinoma is the most common type of liver cancer, and unfortunately, it is growing in the Black community. So as we said, liver cancer is 1.5 times more likely in Black Americans when we compare it to the general population. And even though we have it more often, we also see that there are higher death rates in Black Americans when we compare to other ethnic groups. And that's because we are less likely to be diagnosed at an early stage of liver cancer. So this is the reason that programs like this are really important to educate and know your risk factors and to take control of your health to manage those risk factors. So let's talk about what is a risk factor. What do we mean when we say that? And that is the reason that why someone is more likely to get a disease than the average person. And so this is, of course, not an inclusive list, like it's not everything, but these are some of the most important things when we think about risk factors. And so that includes medical conditions. So if a person has hepatitis C or hepatitis B, those are viruses that can infect the liver and they can be a cause for developing liver cancer. Also, conditions like type 2 diabetes and obesity can result in cirrhosis and the development of liver cancer. So knowing your medical conditions and their risk for developing hepatocellular carcinoma is very important. But there are also lifestyle choices that we make. So things like our diet, what are we eating, and is it contributing to our risk for things like obesity and type 2 diabetes? The use of alcohol and smoking can increase your risk as well. And then if you're sharing needles, and this could be situations where people are injecting drugs, but also things like sharing diabetes needles or using tattoo needles or piercings that are not sterilized. So all of these things can contribute to liver cancer risk. And then ethnicity. So, as we said, just being a Black American is a risk factor for liver cancer. And certainly that's not something we can change, but it is important to know that that is a risk.
For poll question number 2, let's review the risk factors for liver cancer. Which of these on the right would you consider to be risk factors? Hepatitis C or HCV, type 2 diabetes, being Black, African American, or all of the above? Thanks so much for your answer. We'll give it another second or so. Okay, Dr. Brown, please share the correct answer with us.
So if I've been keeping your attention, you know the answer to this is all of the above. So medical conditions like hepatitis C and type 2 diabetes, and then ethnicity, so being Black. These are all risk factors for developing hepatocellular carcinoma and liver cancer. So let's talk a little bit more about these risk factors. So hepatitis B, this is a virus that it can be passed in the blood and in body fluids. And actually, in the United States, the most common way that we see hepatitis B being passed is through sexual contact. Black and African Americans are 2.6 times more likely to die from hepatitis B when we compare it to non-Hispanic white Americans. And it can lead to cirrhosis. So if you have chronic hepatitis B, it can scar the liver tissue and the healthy tissue gets replaced. And that is a risk factor for liver cancer. But importantly, you do not have to have cirrhosis if you have chronic hepatitis B to develop hepatocellular carcinoma. So it is very important that if you have not been screened or if you don't know your vaccination status, that you talk with your doctor, and there's a simple blood test that can be done to know whether you have immunity or if you've ever been exposed or have chronic hepatitis B. And there are very effective treatments to be able to control this disease. Next, we'll talk a little bit about hepatitis C. And hepatitis C is also a virus, and it too is passed in the blood and in the body fluid, but it's more common to be passed by things like sharing needles as compared to sexual contact. Black and African Americans are almost 2 times as likely to die from hepatitis C when we compare to white Americans. But one thing that is really important to know is that there are some very effective treatments for hepatitis C now. So we actually recommend that all adults, so age 18 and over, be tested for hepatitis C at least once in their life. And if you have an ongoing risk factor for hepatitis C, then you should be checked more frequently, even up to once a year. The medications for hepatitis C now are all pill medications, generally can be taken somewhere between 8 and 24 weeks, so 2 months to 6 months. And they cause very minimal side effects, things like being tired, having headache, nausea, things that are generally mild that allow patients to get through that treatment and completely cure the virus. So this is much different than 10 years ago, where our treatments were very difficult to tolerate and took almost a year to complete. So it is very important that if you don't know if you've ever been screened, talk to your primary doctor. Once again, it's a simple blood test to know whether you have hepatitis C. And if you are diagnosed with hepatitis C, then you should absolutely talk with your primary care or a liver specialist about your ability to do treatment.
For poll question number 3, Do you think Black Americans are more likely than non-Hispanic white individuals to die from hepatitis C? Do you know how much more? Would it be 10%, 43%, 88%, or 120%? Give us your answer. Give it a few more seconds. Dr. Brown, please tell us what is the correct answer.
The correct answer here is 88%. So Black Americans are almost twice as likely to die from hepatitis C compared to white Americans. So let's continue to talk about risk factors, and let's talk a bit about type 2 diabetes. So type 2 diabetes is 2 times more likely in the Black community and more likely to experience complications. Type 2 diabetes is an independent risk factor for developing liver cancer. So knowing your blood sugar and having that checked annually with a primary care doctor is important, and maintaining good blood sugar control is absolutely important in reducing your risk for liver cancer.
Let's go to poll question number 4. Based on what we're learning, do you think that type 2 diabetes is an independent risk factor for liver cancer? Yes or no? Give it one more second to get that answer in. Okay, Dr. Brown, please tell us, what do you think?
So we just said yes, right? Having type 2 diabetes alone is a risk factor, is an independent and direct risk factor for the development of liver cancer. Along with type 2 diabetes is obesity. So we know that these two are very linked. And so obesity can lead to type 2 diabetes, and it can lead to something that's called metabolic liver disease, or you may have heard it as fatty liver. And these are both risk factors for liver cancer. This is really important because what we're seeing right now are a significant amount of people being diagnosed with obesity and with fatty liver. So about 25 to 33% of people will have diabetes and be obese. So when we talk about obesity, we can measure that by body fat percentage. And so it's a little bit different for men and women. For men, if you have a body fat percentage greater than 25%, that's consistent with obesity. And for women, that's greater than 33%. Another way that we measure obesity is by body mass index, or BMI, and this is standard no matter what your gender is. And so obesity is having a body mass index of 30 to 39.9. And then anything that's greater than or equal to 40 falls into the category of morbidly obese. And so if you do not know your body fat percentage or your body mass index, it's really important to get this information from your primary care and talk about steps that you should take to make sure that you're maintaining your weight in a healthy place. And so, the thing that really contributes to our obesity and type 2 diabetes can be our diet, and that's something that we absolutely have control over. So a diet that is high in red meats, and so things like beef and pork, or having smothered pork chops, and then high fat sides. So if you're cooking greens and you have bacon in them, or candy yams, those kind of things have lots of fat in them. And so this can absolutely increase your risk for being overweight, lead to obesity, and can lead to type 2 diabetes. And so the thing that we want to focus on is having a diet that is full of fruits and vegetables, whole grains, nuts, beans, things that help reduce the amount of fat that's in the liver, even if it doesn't reduce your weight. And so nothing's perfect, right? You don't have to eat these things all the time, but we want to have more of a focus on having these healthier elements of our diet as opposed to things like the red meats and the high fat sides. And then moving from the medical conditions to lifestyle choices, Sometimes the choices that we make can have a really significant impact on our risk for liver cancer. And these include things like the use of alcohol, smoking, and sharing needles. When we talk about alcohol, there are recommendations that are made by the CDC, so the Centers for Disease Control, about the appropriate use of alcohol. And so for a woman, that's 1 standard drink in a day, and for a man, that's 2 standard drinks. And when we say a standard drink, that doesn't just mean what we're pouring at home, but it is actually 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of a spirit. And so if you're having more than this amount of alcohol, there is a risk to develop alcohol-related liver disease. And so it's very important that you're honest with your providers about how much alcohol and how often that you're using it so that they can screen you for chronic liver disease and liver cancer if you have consumption that might put you at risk. And also, we talked a little bit about sharing needles. So we never want to share needles, no matter what the use is and whether that's getting tattoos, piercings for medical conditions, or the injection of recreational drugs. All of these things, if you're sharing them with someone else, can pass on the virus, particularly hepatitis C. And so completely avoiding the use of sharing needles is extremely important. And then finally, cancer. Smoking, we know, is linked to many, many different types of cancer, and liver cancer is no different. And so if you are a cigarette smoker, then it is important to work with your doctor to find ways that you could quit.
Poll question number 5, answer yes or no. Do you think certain ethnic groups are a risk factor for getting liver cancer? A few more seconds to get that answer in. Dr. Brown, please tell us.
So we're trying to send this message home, right, today. That's why we're doing this webinar. And yes, we do know that certain ethnic groups are more at risk. And yes, we do know that Black Americans are at increased risk. And so this is why we're here today. And we want to make sure that people are aware of this risk. And so let's know our risk and take action. So we talked a little bit about these different types of risk factors. So if you have type 2 diabetes, making sure you have your blood sugar under control. So going to your primary care physician as part of your annual physical, they should do a test called a hemoglobin A1C every year to check for your risk of diabetes. And if you do have diabetes, making sure that A1C is at your goal is really important in reducing your liver cancer risk. We talked a little bit about hepatitis B infection and making sure that you have the screening test to know whether you've ever been exposed or have chronic infection. And if you do have chronic infection, making sure that that is being monitored very closely. And if there's any risk for liver cancer, they should be doing screening tests regularly. As far as hepatitis C, there's an easy blood test here that we can screen. And as we talked about, there are a number of different medications that are very effective in curing, and meaning getting rid of hepatitis C completely. So make sure that you're screened. And if you do have infection, talk with your doctors about your treatment options. Related to diet and obesity, lifestyle changes are hard, but it's working with your doctor. And if you're having issues, even a nutritionist or other specialized resources, and trying to have as healthy of a diet as possible, instead that focus on fresh fruits and vegetables, grains, and those things that are going to be better for your general health and also for your liver health. As far as alcohol, so we talked a little bit about the fact that we want for a woman to not have more than 1 drink in a day, and for a man 2. And if this is something that you are doing, then making sure you get screened through your provider for risk of alcohol-related liver disease. We want to completely avoid sharing any needles, and making sure that if someone is doing a tattoo or piercing, that they open up that package in front of you and know that that needle has been sterilized. And then with tobacco use, we know that it is linked to lots of different types of cancer. So if you are smoking, there are counseling. So there are behavioral interventions with counseling. There are different medications that can be used. So talk with your providers about all of the resources that might be available to help you in quitting smoking. And then finally, as far as being a Black American, that's going to be a risk factor. And so making sure that your doctor is assessing that. And if you do have a high risk, then being screened. So let's talk a little bit about how liver cancer is diagnosed. So there are a number of different things we do when a patient is at risk for liver cancer. And generally it starts with lab testing. So when we do lab testing, we get things like your complete blood counts, and that tells us about your white blood cell count that fight infection, whether you're anemic, and your platelet counts. And that can give us important information about how your liver is functioning, and also the components of your blood cells. The comprehensive metabolic panel is a panel of labs that tells us about your liver and kidney function. And so the liver function panel also gives us the liver function test. And there are multiple tests. So there are 4 tests that we generally look at when we're assessing liver function. If those are abnormal, then your doctor will often do additional testing. The hepatitis panel is a panel that tells us about the risk for viral hepatitis. So that includes hepatitis A, B, and C. And we can tell whether you are immune, so if you've been exposed or vaccinated to these in the past. And then finally, tumor tests. So for liver cancer, there is a type of tumor test that's called the alpha fetoprotein, that's the AFP. And it's not positive in all liver cancers, but if that number is high, that can be a good indication that we need to do more screening. And so all of these tests might be used in trying to diagnose liver cancer. And then the other part that is really important is imaging tests. So generally our imaging tests are going to start with an ultrasound. And ultrasound is used because that's generally a less expensive and more readily available test, and a bit easier to perform. So we will generally recommend that if you're at increased risk for liver cancer, that you're screened for hepatocellular carcinoma about every 6 months or twice a year. If the ultrasound is abnormal, then we will generally go on to do a CT scan or MRI. The good thing about these tests is that we can actually make and confirm a diagnosis of hepatocellular carcinoma without having to do a biopsy. So that's one thing that's very unique about liver cancer. Most cancers require a biopsy to be able to make a definitive diagnosis. About 90% of liver cancers and hepatocellular carcinoma specifically can be diagnosed just with a CT scan or MRI alone. So these tests are really important. But sometimes we do have patients where it's unclear and there's a risk that's there and we need to get more information. And in those cases, we may do biopsies, and there are different types. So you can have a fine needle aspiration where they use a smaller needle to go in. A core biopsy is a slightly larger needle that they will generally put through the skin. And then laparoscopy is a surgical technique to go in and do biopsy. And then they can do tumor mutation testing, meaning genetic testing of the tissue that they remove. So when there is a diagnosis of liver cancer, then it is really important that we know how serious the disease is. And that process is something that we call staging. And in staging, there are 2 kind of really important factors. So the first one is tumor size, or the tumor itself. So what is the size? Is it just within the liver, or has it spread outside of the liver? And if so, where is it outside of the liver? The other really important thing is the liver function. So when we're going to consider the available treatments, we need to know how well the liver is working. And so if a patient has normal function, we call that a class A. If there's some mild abnormalities, then we call that a class B. And then those with really severe abnormalities are going to be a class C. And those are patients that are often a bit too sick to do some of the surgical and larger treatment options. So there are generally 3 stages of liver cancer that we talk about. So the first stage is the early stage. And this is where we will generally try to do curative options for the treatment of liver cancer. And these curative options can be a surgical resection, a liver transplant, and an ablation or heat therapy. And we're going to talk in a little more detail about these in just a minute. Then there's intermediate stage, and that is generally a cancer that is unresectable. So it is often still contained within the liver, but it may be a slightly larger size and we're not able to simply remove it by a surgery. And then advanced stage cancer tends to be cancers that have spread either to the lymph nodes, so the tissues that are around the liver, or has spread to other organs. And when that happens, a treatment to cure the cancer is not possible.
So much good information. For poll question number 6, tell us what you think. What are some of the reasons liver cancer cannot be treated with surgery? Is it because cancer has spread throughout the liver? The tumor can't be removed because of where it is in the liver? Patients are not healthy enough to have surgery? The patient refuses surgery? Or all of the above? A few more seconds. I know this one is a little bit more of a brain teaser. All right, Dr. Brown, please tell us the correct answer.
And the correct answer here is all of the above. So if a cancer has spread throughout the liver, then generally we're not going to be able to do surgery. And sometimes just where it's located in the liver makes a surgery really difficult to do. But sometimes patients are just not healthy enough. Even if it's a small tumor, the patient can have other medical conditions that make surgery not a good option. And then patients always have the right to refuse, and there may be lots of reasons that happen. But any of these could be reasons that we decide to not move forward with surgery. And so now let's talk in a little bit more detail about these treatment options, and we're going to start with the early stage treatment options. So surgery is really the option that we go to when we're thinking about curing liver cancer. So there's a couple different types of ways that we try to do this. When we say like a resection surgery, that means that we're going to go in and try to remove just a small part of the liver that contains the liver cancer. We're going to remove that part and we're going to leave the remaining liver tissue there. Surgery is usually reserved for patients who otherwise have good liver function, so that class A that we were talking about. And that can be situations like patients who have hepatitis B, but they don't have cirrhosis. Their liver otherwise is working very well with a very small cancer, and the surgeon will go in and just remove that small part of the tumor. A transplant is often done in situations where the liver function may not be as good. So the patient still has a relatively small cancer, but it's not safe to remove just a portion of the liver because the other liver tissue is not healthy. In those situations, we will evaluate a patient for liver transplant. And the goal here is to remove the entire liver, put in a new donor liver, and to cure the cancer and also give a new liver that is going to have normal function. Ablation is a type of treatment that's done when a patient may not be a surgical candidate. So they are not a good candidate for a resection. They may not be a transplant candidate for many reasons. And so the ablation, which is still a curative treatment, so all of these options, when you choose the right candidate, can be effective in curing cancer, an early stage liver cancer, at about 75 to 80%. So the ablation is still very effective, and it is a heat therapy. So the radiologist goes in, and a surgeon can do it laparoscopically as well, and they apply heat directly to the tumor, and they try to focus on the tumor cell itself, and then they try to kill those cells and minimize any damage to the cells that are around there. But one thing that's important to understand about all of these is that cancer can come back. So it is still really important, even if you have a curative option, to make sure that you're following up regularly with your specialist and looking to see if the cancer returns. And they will often look for at least 5 years before you're considered completely cured. So then when we talk about intermediate stage treatments, these are generally local treatments. So the cancer is still all within the liver. And these are treatments that are generally done by a radiologist or a radiation oncologist. When we talk about embolization means that we're going to cut off the blood supply. So liver cancers like blood supply. And so they cut off those blood vessels. So they go in generally through a blood vessel in the leg, and the radiologist will go and they'll do imaging at the time of the procedure, and they can inject substances in to the blood vessels, and then they cut that blood vessel off to supply the liver. And these can be very effective treatments. They can provide months to years of time. So even though they are not generally considered a curative treatment, I've had patients that have lived 7 to 10 years after their initial diagnosis of liver cancer doing these types of local treatments. And then as far as radiation therapy, this is radiation that's going to be on the outside of the body, and they're going to use a high energy radiation beam to target the cancer cells and try to shrink the tumor. But once again, very important that you continue to see the specialists regularly so that they can monitor the response to the treatment and make sure that it's working and if the treatment comes back.
So for poll question number 7, true or false? There are no treatments for advanced liver cancer. Dr. Brown, please tell us what's the correct answer.
So that's false. So although we don't have curative treatments for advanced liver cancer, we absolutely have treatments that can be very effective. And we're going to talk about them. So probably the most unfortunate thing is that 80% of the hepatocellular carcinomas that are diagnosed in the United States are diagnosed at advanced stages. And so we don't get all of those options that I talked about for early stage and intermediate stages. But this is the reason that these developments in new therapies is really important, because this is the majority of the patients that we're treating. The good news is that we are continuing to have new and more effective treatments. And so kind of the first line treatments that we had were chemotherapy agents. And I think most people know someone that's had cancer. And when they think about chemotherapy agents, they think about, the person getting really sick that may have nausea and diarrhea and lose their hair and that's because not most with the chemotherapy agents, they're not only killing the cancer cells, but they are killing healthy cells as well. And so there are some of those treatments that are available for liver cancer, but we've moved a little bit past that to these targeted therapies, which really focus on certain parts of the cancer cells life cycle. And so cancer cells, like all cells, have a life cycle that they need to go through. And they've developed some medications that can be very effective in stopping certain parts of that cancer cell cycle. And when they do that, it targets these cancer cells specifically. And what we find is that some of these medications can provide extra months of time above if we did no treatment at all. And they tend to be tolerated a bit better than some of the standard chemotherapy agents. And then I would say kind of the newest kid on the block are these immunotherapy agents. And so these immunotherapy agents are actually medications that are making the body's immune system stronger and able to fight cancer. So our immune system works to try to get rid of cancer cells. So for all of us, even right now, our body is going through and our cells are looking for cancer cells and cells that shouldn't be there, and it's making sure that it gets rid of it. And so what these medications try to do is just boost these cells so that they can more effectively target cancer cells. And we are even though these are relatively new medications, we are seeing a lot of positive effects, and they are being added to our other treatments to give patients with advanced cancer and advanced hepatocellular carcinoma more time. So I think, although it's always hard to hear a diagnosis of an advanced hepatocellular carcinoma, I think we're seeing more and more advancements that are giving patients more time and able to live with better quality of life, which is really important. So the message here is that if you have been diagnosed with liver cancer, or if someone you love has been diagnosed with liver cancer, don't lose hope. So there are a lot of medications that are being FDA approved, and there are a lot of medications that are in trials that are coming out. So every year it seems like there's something different that's coming out. And so it's really important that if you do get this diagnosis, that you make sure that you are seeing a specialist that knows about liver cancer and can help determine what the best treatment options for you may be. And so that may include a cancer specialist, such as an oncologist. And there are some oncologists who specialize in liver cancer very specifically. Also, liver specialists. So, like myself, I'm a liver specialist, and I often am part of the team in making sure that the patient's liver function is doing well, that they're able to tolerate the medications that are being recommended, and also trying to coordinate and help with the other specialists. And in some areas, you may not have a liver specialist, particularly if it's in a smaller area. And gastroenterologists are also trained in liver care and in liver cancer management, and can function very much like a hepatologist in making sure that we have the right specialist involved. And so, we talk a lot about what the providers are doing, but it's also important to recognize and take control of your self-care if you're diagnosed with liver cancer, because there are things that you can do to make this a better experience. And it's things like managing your weight and tracking it. Particularly if you're in treatment and you notice that your weight is going up significantly or down, that can be a sign that something may be happening. And so letting your providers know if you're seeing any major changes. Eating healthy, and so making sure that you're getting getting balanced meals, and that if your appetite is going down and you're having problems with eating, talking to a nutritionist, talking to your provider, and finding ways to try to maintain your nutrition, because that can be really important for maintaining your strength for getting through the cancer specific treatments. Tracking your energy. So sometimes, the cancer itself causes you to be tired. The treatments may cause you to be tired. And so if that's part of what's going on, then making sure that you do the things that are important to you in the times where you have more energy. So it can be things like prioritizing certain activities earlier in the day if that's when you have more energy, and doing something as simple as taking a nap if you need to kind of rejuvenate throughout the day. And then staying hydrated, making sure you're drinking plenty of fluids. These are all things that you can do. And if you're having problems maintaining these things, then ask for help and ask for resources. And so we want to do a little recap here. Just what have we talked about today? Know your risk factors, right? So share what you've learned about your risk factors, and not just thinking about this for yourself, but with your family and with your community. So oftentimes people don't really know some of these risk factors, and they don't know some of this education, and it can be really important, and you may make the difference for someone else in just sharing this knowledge. Making healthy choices. So the choices that we make with our diet, with our exercise, managing type 2 diabetes if we have that diagnosis, all of those things can make a real big difference in our general health and our liver cancer health. Taking action. So going to the doctor, and whether you have a risk factor for liver cancer or not, it's always important to go. And sometimes these things will come out. So making sure you're getting your physical every year, make sure you're reassessing your risk factors, because those can change over time. And then having your doctor screen you if any of those risk factors are present, and know your options, so that if you are diagnosed with liver cancer and an advanced liver cancer, making sure that you have a specialist and you have providers that can educate you on all the available options and help you to choose the thing that's right for you. And then just communication. Communication is always important. So if you don't understand what your doctor is telling you, if you feel like things are not going well, communication is the most important thing because your providers can only help you if they know what you're going through. So keep that dialogue open. Keep the dialogue open also with your family and those around you. This can be a really tough disease to go through, and the support of your providers, the support of your family can make all of the difference. And so that's part of what Love Your Liver is here for, is to make sure you have this knowledge and this support.
Our last poll question is a challenge to you on knowing what is important to you and what you've taken away from this knowledge that's been shared. After this presentation, will you make an appointment with your doctor, get screened for liver cancer, tell others about this information, or all of the above? So, Dr. Brown, what do you think?
I hope that the answer here is all of the above, right? That's what matters the most, is taking action, not only for yourself, but also for your community. And I just want to say thank you so much. I see all these hearts and all these positive things coming up. And I hope that we've given you some really great information today that is going to allow you to take the action for yourself, for your family, and for our community. So thank you so much.
Thank you so much, Dr. Brown. Before we move on to our Q&A, we must thank our sponsors, AstraZeneca, Merck, Bristol Myers Squibb, and Genentech. Thank you so much for allowing this seminar to happen. And with that, we will move on to our question and answer section. We have lots of excellent questions. So I will read the first one. Who has more risk for liver cancer? Someone with diabetes or a person with fatty liver? Dr. Brown?
So, fatty liver is kind of a large generic term. And most of the time, when we talk about the risk factor for type 2 diabetes, it causes fatty liver. And so the risk there is probably going to be about the same. But if you have type 2 diabetes, because it is an independent risk factor, your doctor should absolutely screen you for fatty liver, which means doing an ultrasound. They can see fat on the ultrasound. And if there's any family history of fatty liver, that should also be a risk, a reason to do an ultrasound.
Excellent. Our next question. What should be the range for EGFR? Dr. Brown?
So that's a little bit different than what I do, because that's the EGFR, that's the glomerular filtration rate. So that's related to the kidney function. There's been a lot of change with that because of thinking about, in the past, we've looked at ethnicity. So there were different ranges if you were Black as compared to white and other ethnicities. And so there's been a lot of research recently in trying to get rid of this because of some disadvantages that have happened. So we generally say if it's over 60, that is considered the normal range, but there are some changes that are happening with that related to kidney function.
Excellent. This question is quite good, and I would love, excited to hear your answer on this. How do you differentiate BMI with the Black community when BMI is not truly accurate for all races and genders?
So yes, we do know that BMI was created with few minorities when this was developed many years ago. And so it has brought into question using that. But I will say there's no perfect standard. I think you can use it as a guide. And what also matters is where you hold your weight, right? So when we talk about weight that is more in the chest and the abdomen area, so what's called central obesity, that carries more risk for heart attacks and also for fatty liver and liver cancer, as opposed to those that we call pear shaped, where the weight may be more in the waist and hip area. And so I think you have to talk with your doctor, and you shouldn't just dismiss it. So I understand, and I have these conversations sometimes when people say, well, this isn't, I'm not trying to be a BMI of 20 or 22. And I think that that's fine, but you also don't want your BMI to be 40. That's not going to be healthy for any of us. So assessing your risk factors, finding a balance of your diet, your exercise, I think is important, and having goals that are realistic for you.
So, gist of what you're saying is that it's an important guide to monitor it, but obviously your doctor will know where your health status falls within that range.
Right, because I absolutely have patients. So we talked a little bit about obesity, but overweight is a BMI of 25 to 29.9. And I absolutely have a lot of patients that fall into this overweight category, but they don't have diabetes, they don't have high blood pressure, cholesterol, and things that are risk factors for metabolic or fatty liver disease. And so you can kind of look at the overall health status. If someone is in this like overweight category, but they have no metabolic risk factors, then I'm not so worried. But if someone does have fatty liver, then we should be using that BMI and trying to focus on weight loss.
Thank you, Dr. Brown. This is a good segue. How much fat in the liver can turn into liver cancer?
Oh, goodness. So they're a little bit different. So I can tell you if you have more than 5% fat, that's where we call fatty liver. So all of us can have up to 5% fat in the liver, and that is considered normal. It is not the amount of fat that's in the liver that is a direct link to liver cancer. So certainly if you have fatty liver, it's going to increase your risk. But just because someone has 70% fat in the liver, it doesn't make their risk greater than someone who has 20%. So the more important thing is whether the fat causes cirrhosis or progression of liver disease. And that's something that we can monitor with testing. So there are liver stiffness tests that we can do and look for the development of cirrhosis. But I think if you have fatty liver, you absolutely should be getting monitored. First by your primary care, and then if the primary care finds that there is advanced liver disease, so things are moving towards cirrhosis, they should send you to a specialist.
And the next question, what diagnostics and their frequency are recommended for management of NASH, NASH, in preventing the progression of liver cancer?
I'm going to say you guys have some really good questions here. So normally where things start, if we know that someone has NASH, and so I will just say NASH has been replaced with this metabolic liver disease. So NASH is the same thing as fatty liver. And instead of fatty liver, because we're trying to take away some of that fat being part of it, the name metabolic, you might start to hear as well. And so if you have that, kind of the first thing that should be done is what's called a liver stiffness or elastography test. The majority of people who have fatty liver or NASH actually are not going to have progressive liver disease. So about 75% of people with fatty liver will just have fat in the liver and it will never progress. It won't cause liver cancer. You just have the fat there. And if we do the blood test for the liver, they're normal. But the concern is there is 25% of people who will progress. And those are often the people who come to my clinic. And that's where I will continue to do these liver stiffness tests. Sometimes as frequently as about once a year. And if a patient does develop cirrhosis or scar tissue from that, then we do an ultrasound every 6 months to look for liver cancer specifically.
Another question, are there any types of liver detox that you would recommend or any natural remedies?
So I do not, and I will qualify that by saying many of the natural remedies, and even though things are in the over the counter section, they are not FDA regulated, meaning that those medications can have components and things in them that we don't know about and that are not regulated. And I have very rarely had a patient that has gotten sicker, so gone into liver failure because of a natural remedy or something that they used or herbal because it contained something that was not safe. So the liver is a filter. The less work that it has to do, the better. So in general, I don't recommend detox because there's so many things that are out there that say that they're detox, but it just has natural components of things that are really not doing anything specifically for the liver. If you are someone who really wants to try something, milk thistle does have some research data. And so many of these things will at least have milk thistle in them. And if you're going to use a natural remedy, then that is one to use.
Can low iron and vitamin D levels contribute to liver issues, Dr. Brown?
They should not. So a lot of people are anemic. You can be anemic for many, many different reasons. A low vitamin B12, folate, iron, some medical conditions. So many different things can cause anemia. And vitamin D is really low for most of us because most of our time is spent inside as opposed to outside in the sun. And even when we're in the sun, we're using sun protection and sunscreen. So we're not getting those UV rays. So actually, many people, unless you're outdoors most of the time, have vitamin D. And so while they may cause some symptoms and people may feel fatigued and it can be helpful to get those levels to normal, they don't generally result in liver disease.
Is jaundice caused by hepatitis B or C?
Jaundice can be caused by anything that causes hepatitis. So hepatitis just means inflammation of the liver. So anything that is hepatic, and that's why I'm a hepatologist, my specialty is the liver, that's related to. Jaundice just means that this bilirubin, the bile that the liver makes, can't get filtered out of the liver the way that it's supposed to, and it goes into the skin. So jaundice means that the skin becomes yellow. Sometimes for some complexions, that's easier to see in the skin. Often the easiest place to see it is actually in the eyes. And so when the bilirubin gets elevated, so the normal range is at 1.0 or less. If it gets to 2.0 and higher, that's where we see the eyes turn yellow, and we can also see the skin turn yellow. But that can happen with hepatitis B, hepatitis C, or any other cause of either chronic or acute liver disease.
Wonderful, Dr. Brown. What about vaping? Does it increase your risk as much as smoking?
Um, so vaping, I don't know the literature on vaping as well. I think there are concerns that we are finding that vaping is having a lot of the negative health outcomes that we associate with tobacco. So I think as more and more research is being done, we're kind of trying to get people to stop vaping as well. But I will say I don't see that as much. And so that's not something research that I am as familiar with.
Wonderful. And for our final question, why are folks getting their liver cancer diagnosis so late or too late?
Yeah, it's a really good question. I think a lot of liver disease is very silent. So people don't develop symptoms until it's really advanced. So if you're waiting to the time that you have jaundice or that you develop really bad abdominal pain, those type of symptoms come with really late stage disease. The best way to help your liver, and this is why we keep talking about going to your provider and going to your doctor. When you get your annual physical, a liver panel is on that physical. So they get that comprehensive metabolic panel. And you want to be aware of what those numbers are, because sometimes even as providers, they could see a little bit of abnormality. So that number might be a little bit high, but they'll say, oh, we'll just check again in a year. And so you want to know your numbers. You want to talk to your doctors about it. And if those numbers are abnormal, then there should be further testing to look for why. So is there fatty liver? Do we need to screen for hepatitis B, hepatitis C? And based off of these risk factors, that's where we get the other testing to look for ultrasounds and liver cancer. And so it's really about education. Not enough people, and that includes providers, really think about the impact of liver disease. And so that's one of the reasons that these type of webinars are so important for making sure that people are informed.
Well, Dr. Brown, this was a highly informative presentation. Thank you so much for taking the time. And thank you, participants and attendees, for joining our event. Today, we learned about liver cancer risk factors in the Black and African American community. To learn more about liver cancer and liver health, visit loveyourliver.us. Please prioritize your liver health and go see your doctor for regular checkups. Talk to your doctor about any risk factors for liver cancer that you may have. And thank you all so much for your time. Have a lovely evening.